Should we consider treating conditions like chronic pain and even depression without medication? Now, that is a question posed by one doctor who's been investigating the UK's reliance on prescription drugs.
And he joins us now, we're delighted to say, Dr Rangan Chatterjee, GP and author. Thanks so much for joining us. Very good to see you.
Yeah, thanks for having me.
So both over a programme last week and your book, you explore some of those conditions. I think type 2 diabetes, chronic pain and depression, which I guess are probably quite widespread conditions in the UK, and whether we're treating them in general too often with just medication rather than other solutions.
Yeah, I examined this in the Channel 4 show Live Well with the Drug-Free Doctor, which came out last Thursday. And essentially the idea is that as medical professionals, the prescriptions we give out in the UK have gone up by 80% in the past 20 years. Now, that's quite a staggering amount. If all of the prescriptions we were giving people were helping them, that would be a good thing. But the uncomfortable truth is that for some conditions, they're really not. A lot of the time, the medications we give are merely there to suppress symptoms and not get to the root cause of the problem. And so what I did on the TV show is show that for 3 of the conditions that are costing the NHS the most money, type 2 diabetes, chronic pain and depression, I went through case studies to show that actually it is possible for some people with those conditions to heal without using medication. And I think the response to the show has been phenomenal because I think if you ask patients, would you like to try and heal without the use of medication, most patients would say yes.
So I think it's important to say, you're not anti-medication,
not
anti-drugs. You're not one of these kind of woo-woo, it's like your medical background. What you're saying is it's used as a quick fix sometimes, and actually there are better ways of addressing those root causes.
And exactly. Look, modern medicine is life-saving. It's just phenomenal what it has done over the past few decades. At the same time, we have to recognise that modern medicine is not fantastic for everything. It's good at certain things, but not everything. So type 2 diabetes, for example, is a condition that is driven by the way we're living our modern lives. That's not putting blame on people. I get that modern life is tough, but nonetheless, many clinicians, like myself, have been helping people put their type 2 diabetes into remission for years.
How do you do that then? What should we be doing?
Well, first of all, you need to empower the patient. You need to help them understand that, hey, this is a condition driven by your lifestyle. Now, there's probably some things in it that you may not be aware of that contributed to this. Would you like me to help you understand what those things are? Now, if the patient says, no, just give me the medication, I will respect that. But a lot of the time, we're not giving patients that option. So in the show, for example, we showed that there's an approach that Dr David Unwin uses in his NHS practice in Liverpool, where he has saved hundreds of millions of pounds in terms of his drug budget by putting now 154 patients, helping them reverse their type 2 diabetes by strategic elimination of carbohydrates. And that doesn't mean everyone has to do that. If you have type 2 diabetes, it may be at that point you need a different diet to someone who, let's say, doesn't have that condition. But depression is another thing that I think we need to take seriously. And I was really pleased that came up in the show because 20% of the UK adult population are currently taking antidepressants. Now, I don't think you need a rocket scientist to go, there's something wrong with that. Do we really think it's okay for 20% of the adult population to be taking antidepressants? Well, I would say, again, it's not about putting blame on people, but it's about helping them understand that there are other things that you can do for these conditions.
So let's just explore that a little bit more, because I guess when people are depressed, it's a very desperate time, and you don't want to not give them a drug that might help, even if it's only initially in the short term. So how do you address that with your patients, if it might then mean not giving them something that they feel they need? And what's the message to people out there who might be experiencing some form of depression, of how they can try and improve their situation without taking a drug?
Yeah, it's a great question. Look, first of all, I'm not talking about depriving people of treatment that could be helping them. I'm absolutely not talking about that. What I'm talking about, the idea is that depression is a great example. Okay, someone's not feeling good in their life for a variety of different reasons. Now, is depression a disease to diagnose, which is how we treat it in medicine, or is it a sign that we need to understand your life a little bit better? Perhaps, for example, your depression makes sense in the context of your life. Let's say you've left your family, you've gone to the big city for a better job, but you're lonely and you're isolated. Well, Maybe feeling depressed is an appropriate response to the state of your life, but that's not how we treat it in medicine. So it's all about having these open discussions with people and helping them understand that perhaps medication is what you need, but perhaps it's not. And I think as a society, we're too quick to rush to medication these days. I'm not blaming doctors, right? Because I understand the system. If you've only got 10 minutes with a patient and you've got 5 people waiting outside, before you know it, it's easier to give a prescription. But often that doesn't get to the root cause of the problem.
It's been fascinating. Yeah.
Really, I just a quick follow-up on that. So is the teaching wrong? Is the profession, not the individual doctors, wrong, that we've approached this in the wrong way?
Yeah, I think essentially what we've done is we've taken the modern medicine approach that works so well for acute problems, like a chest infection or a pneumonia. Right, there's a problem, we'll give you a pill, the pill fixes it. And we try and use that approach for chronic conditions that are driven by our modern lifestyles. And that's why I think that there's a slight friction.
Really fascinating. Thanks so much for joining us.